Hisar Foundation and Engro Foundation, in association with TV1, NewsOne, Wakeup and FM 91, presents the 5th Karachi International Water Conference webinar series on climate change and pandemic impact on water.
I welcome you to the 5th Karachi International Water Conference, which is being held this year as a webinar series on climate change and pandemic impact on water.
There were serious issues with respect to availability of safely managed water. Water, if you drink, you will be sure you will live, but there are many places where we drink water and at your own risk. So there are serious challenges which were there.
26% of the global population doesn't have access to safely managed drinking water. We need to move forward. We need to find a way to integrate all these issues.
We need to learn from our COVID experience and come together as one. And the whole world needs to be on the same page like it was for COVID.
I would like to invite Dr. Sheikh Tanveer Ahmed.
Thank you, Dr. Shahzad, and thank you, Hisar Foundation, especially CV Kamal, for providing me this opportunity. Let me share my presentation and then I can go ahead. I'm going to give you a case study of HANS with respect to the COVID-19 and water. HANS vision, as you know, is quality of life for all in an equitable, human, peaceful, and sustainable world. One can imagine the scale of the organization. If I briefly describe you the highlights of 2021 only, we have done. We have received the grant of nearly 2.5 billion rupees as per our average annual grant, which we have expanded out in nearly through the 33 branches, which is our district offices, and 10,505 workforce. We did it with 92 projects, and we have reached to nearly 31 million population of 25,000 villages or urban settlement. We have done this intervention in nearly 56 districts of the country, and our direct beneficiary was of nearly 6 million. So if we talk about the pandemic challenges, so I can compare the challenges into two areas. One is when in March 2020, the pandemic started, there were two kind of the challenges we face. One was at the community level, the community-based challenges, and the other was with the organization or services-based challenges. So let me start with the community-based challenges. One, as you all know, that the hand washing was the prior requirement as far as the prevention is concerned. So we have seen a lot of challenges as far as the not only of the knowledge but also the accessibility and availability of water for the hand washing in different places. The affordability and accessibility of soap in the rural and remote communities. Then accessibility of safe sanitation was a challenge. As you know, rural areas of the country don't have a very good sanitary systems, although we are working on it. And then awareness of health and hygiene was again a challenge. As soon as the lockdown and the incidence rate increases, the transportation becomes one of the challenge for the community, not only for going to for the livelihood, but also to the health facilities. Increased domestic violence is again comes as a challenge in the community when people were stopped to were locked down, asked them to stay at home, so the domestic violence increases. Similarly, livelihood issues, as we all know, increases with the rate of the incidence rate of the COVID. In our services base, and when I say services base, since we as an organization working as an organization, as offices, and then we work through the health and education and the other services through some facilities, hospitals, dispensaries, clinics, or schools. So availability of the protective environment, for protect not only in terms of the tools, PPEs, like mask, gloves, sanitizer, for example, was also a great challenge. And then the accessibility of water and washing station within the hospital. And since we work more in most of the public sector hospitals, the public sector hospital was not really ready and prepared and equipped with the hand washing facilities. Hand washing facilities for the providers and the client was also the question. What a great question. The accessibility of hand washing station, as I said, was a great challenge. Then the toilets availability, sanitary facility, for example, in the hospitals, in the schools, and the other facilities was also a challenge. Knowledge of sterilized techniques, not only the medics were not very used to of this kind of the sterilization, which we are asking in the COVID situation, but also the paramedics in the hospitals, teachers in the school, and the students were also went through this challenge. Again, transportation at the hospital level, transportation not only for transporting the staff to the organization, but also transportation to the health provider, to the hospitals, and was a great challenge, which is reduced as far as the incidence rate increases and the lockdown period is. Then considering the organization working in emergency area, we have got the special permission from the Home Department and the Health Department to work in the lockdown timing as well. And so we use our transportation with the special mark on the special emergency services, and we were allowed to do it. But even then, transportation was a challenge for many of the most of the staff members. Same reflected in the low staff attendance, high COVID positivity in the staff, especially the healthcare provider, was really on the forefront of the water sanitation issue. We also work on strengthening health facilities. We were taking care of the hundreds of the health facilities, especially the isolation and quarantine centers of those health facilities, in terms of not only of training of the medics and paramedics, but also providing them the PPEs, the other sanitizers and other facilities. And then also provide them provision of the washing units for them, for not only for providers, but also for the patients and clients. We have done intervention in the school projects, school area as well. Hundreds of the schools were given with the soaps and to maintain the hands and hygiene, and not only soap but also the mask and sanitizer as well. Similarly, these very innovative kind of the work was done by hands, staff of water department, that the paddle hand washing station installed at the public places and healthcare facilities. These are the untouched paddle stations, which is installed in many places across Sindh, and then in southern part of the Punjab also. In few facilities we have provided to address the scarcity of water out of plants in health center, and then the wash facilities also provided to many of the schools and the hospitals. Provision of water and water tanker was one of the facility which we have provided to nearly hundreds of places, just to address the hand washing issue and sanitation issue.
Sir,
Similarly,
yeah. I think you have 2 minutes, kindly.
Okay.
If you could wrap.
Yeah, capacity building is done through psychological counseling services. We have thousands of workers, community-based worker. We call it Mavi worker and community resource person. Through them, we did the counseling session. We have done a study which tells us that 50% of the population was under depression at that time. So counseling proves a very important area. Teachers were trained, sanitary workers were trained, and then the healthcare provider was trained. So provision of material, as I already said, a lot of material on sanitation and hygiene was made. The community outreach, mass communication took place. A lot of intervention through radio, talk shows, through SMS messaging, through LED plays in the public spaces, Android phone provided to the Mari workers. Through with the awareness raising, and we have reached thousands of students and religious leaders to raise the awareness raising. So this is a material which we have developed. So many material during this period COVID. Then we went into the COVID vaccination. Once the vaccination started, nearly more than 300,000 shots was given in terms of with the partnership of many of our corporate partners. The recommendation which I want to make as a last slide of my presentation, that highest permanent forum in Pakistan to establish both at the provincial and the federal level with multi-sectoral stakeholder to deal with any pandemic in future. An endowment fund needed to be allocated with every year incremental on the incremental basis, so that any pandemic can be addressed as an emergency. Strengthening of integrated public and private health system required, which is very we have realized that there is no integration of health and public and private health system in the country, both at the primary level, secondary and tertiary level, and with optimal watch facility. This should improve the health management information system to effectively deal with the pandemic in the future. Accelerated digitalization. Digitalization provide opportunity for us, as we have done in the organization, then it should be done in the health system as well. So proactively involve the mass media communication, which we have learned that very well done by the NCOC in the country, and this mass media model remain should be engaged with the other diseases and pandemics also. Strengthening of research and development in the university to provide backup support is again an important area. Vaccine manufacturing is required locally to and to that needs support to the private sector, and strengthening of emergency and transport system. Both of providers and clients is required when they expand. So this is all from my side. Thank you very much.
So kind of you, sir.
मैं आप सबका ममनून और मशकूर हूँ। आगे बढ़ने से पहले मैं आपको अपनी प्रेजेंटेशन दिखाना चाहूँगा, जिसका मौजू केस स्टडी हैंड्स है। पानी और कोविड-19 के हवाले से हैंड्स का विजन है एक पुरअमन, मुनसिफाना और पायदार दुनिया। मैं यहाँ आपको 2020 और 21 के नुमाया कारकर्दगी के हवाले से बताना चाहूँगा। सालाना ग्रांट हमें 2.511 मिलियन रुपए की मिली, जिन्हें हमने 33 डिस्ट्रिक्ट ऑफिस में दिया, जहां मेहनत कशों की तादाद 10,505 है। यहाँ हमने 92 प्रोजेक्ट्स पे काम किया और 31 मिलियन आबादी तक रसाई हासिल की। तकरीबन 2,500 से ज़ायद देहात, 56 अजला में काम हुआ और 6 मिलियन लोग इससे मुस्तफ़ीद हुए। यहाँ अगर मैं आलमी वबा में दरपेश मुश्किलात का जिक्र करूँ तो 2 तरह की मुश्किलात आईं, एक कम्युनिटी की सतह पर, दूसरी खिदमत की सतह पर। पहली बात करते हैं कम्युनिटी की। लोगों को हाथ धोने की तरगीब देना, फिर पानी की तक रसाई होना, साबुन तक रसाई और क़ुव्वत ख़रीद होना, सफाई सुथराई के अमल तक रसाई हासिल होना, सब एक चैलेंज की सूरत में सामने आए। वबा में नक्ल हमल के हवाले से भी लोगों को काफ़ी मुश्किलात का सामना करना पड़ा और घरेलू तशद्दुद के भी वाक़यात में इजाफा सामने आया। इस तरह रोज़मर्रा ज़िंदगी में बहुत से मसाइल सामने आए। बहैसियत ऑर्गेनाइजेशन हमने जिन चीज़ों में मसाइल का सामना किया, इनमें से मास्क, सैनिटाइज़र, दस्तानों वगैरह की फरहामी, पानी और साबुन की फरहामी और हाथ धोने की सहूलत को सबके लिए यकीनी बनाना, बैतुल खला तक रसाई, जरासीम कशी के हवाले से आगाही, नक्ल हमल वगैरह शामिल हैं। कोविड-19 की वजह से स्टाफ की हाजिरी में कमी रही, जिससे काम में खलल वाक़ हुआ اور کووڈ-19 میں خاصا اضافہ ہوا، خاص کر ڈیلٹا میں۔ پانی کی صفائی اور حفظان صحت کے اصولوں پر ہم نے خدمات پیش کی۔ ان میں اسپتالوں میں حفظان صحت کے اصولوں پر عمل درآمد کو یقینی بنانا، قرنطینہ سینٹر کا قیام اور ان میں حفظان صحت کا خیال رکھنا، اسکولوں میں ہاتھوں کی صفائی کے حوالے سے نہ صرف آگاہی فراہم کی گئی بلکہ ماسک، صابن، سینیٹائزر کی سہولت کو بھی یقینی بنایا گیا۔ ہینڈز کی طرف سے پیڈل ہینڈ واشنگ سولر قائم کیا گیا۔ ہیلتھ سینٹر میں آر ڈی گلینڈز لگائے گئے اور بہت سے اسکولوں اور ہسپتالوں میں ہاتھ دھونے کی سہولت متعارف کرائی گئی۔ اس کے علاوہ کمیونٹی میں سینکڑوں کی تعداد میں پانی کے ٹینکرز پہنچائے گئے تاکہ پانی کی فراہمی اور صفائی کو یقینی بنایا جا سکے۔ اس کے علاوہ صفائی کی صلاحیت کی تعمیر کے لیے جو اقدامات ہم نے اٹھائے ان میں نفسیاتی مسائل کے حوالے سے مشاورت کی خدمات نمایاں ہیں۔ ماروی کے لوگوں اور سی آر پی ایس کے لیے ذہنی تناؤ ختم کرنے اور ان پر قابو پانے کے لیے سیشن کا انعقاد کروایا گیا، کیونکہ وبا نے تمام لوگوں کو ایک قسم کی ذہنی دباؤ میں مبتلا کر دیا تھا، جس کے لیے ایسے سیشن کروانا بہت ضروری تھا۔ اس کے علاوہ صفائی کے حوالے سے جتنی بھی ضروری اشیاء تھیں ان کی فراہمی کو یقینی بنایا گیا۔ اس کے علاوہ ابلاغ عامہ کے تحت لوگوں کی آگاہی دی گئی، جیسے کہ طلبہ کو آگاہی مہم کے ذریعے کووڈ-19 اور صفائی کے حوالے سے آگاہی فراہم کی گئی۔ ریڈیو ٹاک شوز منعقد کروائے گئے۔ ماروی رضاکاروں کے لیے اینڈرائڈ فونز فراہم کیے گئے تاکہ وہ لوگوں کو آگاہی دے سکیں۔ سوشل میڈیا کے ذریعے لوگوں کو آگاہی دی گئی۔ عوامی مقامات پر LEDs نصب کر کے آگاہی مہم چلائی گئی۔ مذہبی رہنماؤں کی مدد سے عبادت گاہوں میں آگاہی پہنچائی گئی۔ اس کے علاوہ وبا کے حوالے سے آگاہی کے لیے IEC مٹیریل بھی لگوایا گیا۔ پھر جب حفاظتی ٹیکوں کی مہم شروع ہوئی تب ہم نے اپنے شراکت داروں کے ساتھ مل کر آگاہی مہم چلائی اور 300,000 لوگوں تک رسائی حاصل کی۔ سفارشات کے حوالے سے میں چاہوں گا کہ مستقبل میں ایسی وبا اور اس سے ہونے والے نقصانات سے بچنے کے لیے ہمیں مختلف اداروں کی مشترکہ خدمات حاصل کرنی چاہیے۔ سالانہ فنڈز اس مد میں ہونا چاہیے۔ صحت اور صفائی کی آگاہی اور اس کے انتظام کے سلسلے میں کام کرنے کی ضرورت ہے۔ مستقبل میں وبا کے اثرات سے بچنے کے لیے صفائی کے بہتر انتظام کی ضرورت ہے۔ ابلاغ عامہ کے ذرائع کو ڈیجیٹل سطح پر تیز کرنے کی ضرورت ہے تاکہ صحیح خبر عوام کو پہنچائی جا سکے۔ یونیورسٹی سطح پر ڈیولپمنٹ ریسرچ کو مضبوط بنانے کی ضرورت ہے۔ ویکسین بنانے میں پرائیویٹ سیکٹر کی مدد درکار ہے۔ نقل و حمل کو فوری بنانے کے لیے اس نظام کو تیز اور مضبوط کرنے کی سخت ضرورت ہے۔ بہت بہت شکریہ۔
At this point, I'd like to invite one of my favorite people in the world, Afia Salam, to take on and do her presentation. Afia, Saiba.
Thank you very much. And I've got just 2 or 3 slides with the text, and I've got more pictures because just this past week I've been traveling in places which do not present the picture that generally people are able to see of another Pakistan. A Pakistan that is so far removed from the things that we have been speaking about, hearing about, and where disease and illness and deprivation and just total marginalization take over anything. And that pandemic seems to be something from another planet, happening to people of another planet, because the planet that these people are living on, they have, it's so totally far removed from that. So can we just move to the next slide? So when the pandemic hit, now these are the things that all of us, we were living, eating, breathing these things. We were told that these are the SOPs and this is the only way to keep ourselves safe. Frequent hand washing, the first one. Sanitization, yes, everybody, I think people had more alcohol, their hands had more alcohol than they were, the systems had otherwise in their whole life. Face coverings, of course, the masks. Social distancing, people said maybe the better term would have been physical distancing, maybe because we got more socially connected through platforms like we are connected on right now. Then when the vaccine was discovered, rather invented, so vaccination, and if you did catch the virus, then of course to isolate yourself. And then I go into these areas and I'm stumped, that how are any of these things, I mean, even if I want to take just one of them, how do you implement them over there? So can you go on to the next slide, please? So all I have are these images. Now these women, and this is one of a very modern facility. This is a reverse osmosis plant in the desert of Tharparkar. And because there is a very, very clear water and women nexus, so there's absolutely no question of women not being there in a big group and taking water. So they cannot be covered, they cannot isolate themselves, they cannot maintain any kind of social distancing. They obviously cannot sanitize, and the water that they are carrying from there, you may be looking at so many, these drums, canisters, whatever you want to call them. But these are enough just for a few hours because the households are large. And these canisters contain water which have to be given to the livestock, for the children, for cooking, for washing, for washing the utensils, washing the clothes, for personal hygiene. So with this, the number of the items on the checklist, frequent hand washing just falls by the wayside. So this is one image. Can we go to the next one? Now these are the number of people, and these are only because I was sitting in one corner and I could only point my phone. These are those round houses there in Tharparkar which are called choras, and these are the only people I could fit into one frame. There were just about as many sitting on the other side as well, and those are the normal number of residents of one household. So where do you isolate if somebody gets ill? How do you maintain physical or social distancing? So these are just some images that I want people to keep in mind when we offer or pose those solutions, or which were there for the thing. The other picture is of a bazaar in a small town. Look at the proximity of the shops. They are very small shops. Some are, and if they don't go there, if those fruit vendors and other vendors are not standing outside, where is the livelihood? Who is going to feed them? So they go there and they are exposed to all kinds of risks, even otherwise, not just the COVID risk, but all kinds of risk of any other disease is there, and they don't have a way out. So the topic is SDG 6, which is not just about water, it is about wash, sanitation as well. So we did the W, we'll do the S. That little thing over there you see is the common sort of toilet of the entire village, and it's only those who want to go there for privacy who get to go there. Otherwise you can see the open fields, that's where most of the people go to relieve themselves. So open defecation, we I think are the number 2 country in the world. So there's no surprise why, because there is very, very little attention or resources that have been put into the the bracket of sanitation. Next, there you have it. This is the kind of living they have. These small buckets. You can see a small green thing. If you see over there, that is called a roller, which the organization I volunteer with. We provided them to some communities over there. They were small in numbers, so we decided to give them to the woman living farthest from a watering hole, a woman who was elderly and a pregnant, because no matter what age you are, no matter what state you are in, state of health you are in, or you have to go and fetch water. So that again is a burden that women bear rather. So we try to sort of lessen just the physical burden. The social burden is still there. And with this kind of a burden, there's there's no chance that these people can do anything when COVID comes calling. They don't even know what COVID is and whether it did come calling over there. So there's no tracking of the virus into these kind of communities. You don't know who's dying of what. You don't know whether they died of COVID or they died of something else. So these are the harsh realities we should also. Now these are the rural areas, the hinterland of Karachi and the pure rural areas. Next slide. This is Karachi. This is a locality called Punjab Colony. which is right next to what many in the media like to call posh. I don't know the definition of posh. These tiny, crowded lanes, these tall buildings, crowded lanes, dark alleys do not offer you a chance for isolation, for distancing. You do not really get drinking water or any other water in enough quantity to be able to put in place all the SOPs that were, shared with everybody and anybody. Next. This again is another Karachi locality. I showed you one next to the posh locality. The other one is a mushroom growth, because where is the housing? Where is the planned housing? You don't see it anywhere. And in this kind of living conditions, if really the disease or the virus becomes, so it's a pandemic, yes, but we really don't know the magnitude or the extent of how many people it has gulped, because who's testing, who's tracking who died of what? As I said about the rural area, it's the same about the informal localities of Pakistan, and Karachi has some of the largest, 60% of Karachi lives in these kind of localities. So any kind of SOPs maybe you can lock them down, yes, with the SOPs. You can have the rangers stand outside the lanes or the exit and entry points, but that's just about it. Everybody else is then crowded in one small room. So if there is a COVID patient, so be it. The entire household is exposed. Yeah, so whose responsibility? Everybody's responsibility. So obviously and there's a reason why I've listed these in this order, because the government is the one which is supposed to come up with the resources. And I really do think that the civil society organizations' role in awareness has to be acknowledged, as well as also acknowledge the fact that this is the role that they should play. Again, civil society organizations bear a greater burden than they ought to of becoming service delivery organizations, and that allows the government also to abdicate its responsibility. And in any case, civil society organizations or NGOs, or for that matter even INGOs and these big donor organizations, do not have the scalability that the government itself has and should. So the resources that the government has at its disposal in times of pandemic like the COVID-19, they need to be reallocated. There's so many things that government should just put on the back burner and put the resources in upgrading the sanitation. If we only focus on SDG 6 and its nexus with with COVID, as is the topic of this particular stream of the Hisar webinar, just on this one topic, we know the inequities, we know the injustices, and we know the huge gaps. They're there for anybody to see who wants to realize them, and that's where the government should divert the funds. This is one time, like I think Dr. Nadia had also said, and other participants in the earlier session, that the attention is there, and the organizations are willing to divert resources to upscale and upgrade, and where there is none, to put in place these resources to be able to meet the SDG 6. So then we would like to see the government try to rally the giver of those resources, and then get the resources and put these things in. Individual actions, yes, individuals need to be told of water resource management, because we waste a lot of water. And again, it is a question of haves and have-nots, and the inequities, who gets the water and who wastes them. It's not obviously the people who are keeping that one drum to fulfill their needs for the whole day. They are not really wasting the water. There are people who get more water than them, so they are the ones who are wasting water. So we need to, see assigned responsibility. Next slide. So for SDG 6, the government, so all those three partners that I said, the government, the individuals, the CSOs, NGOs, INGOs need to track where we are going, what are we doing to meet this SDG, evaluate. There's always room for course correction, although we are almost halfway down. I mean, 2030 is around the corner when we are supposed to meet. So we know what happened with the MDGs. So I hope we perform better on these.
बहुत शुक्रिया. मेरे पास इस वक्त तहरीरी स्लाइड्स 2 से 3 हैं और ज्यादा तसव्वुरी स्लाइड्स हैं क्योंकि बहुत सी चीजें हैं जो हमें पाकिस्तान की अक्कासी करती हुई नजर नहीं आती. तो पढ़ते हैं अपनी पहली स्लाइड की तरफ. वबा के हवाले से SOPs हैं. इनमें बार बार हाथ धोना, फासला रखना, सफाई का ख्याल रखना, मुंह ढांपना, वैक्सीनेशन करवाना और वबा की सूरत में खुद को लोगों से अलग रखना शामिल है. अब आते हैं तस्वीरों की जानिब, जहां आप देख सकते हैं कि ये थरपारकर का एक इलाका है जहां RO प्लांट लगा हुआ है. ये औरतें कोविड-19 के दौरान ही यहाँ पानी भरने आई हैं. अब क्योंकि ये साफ पानी है तो यकीनन ये खवातीन यहाँ अपने लिए पानी लेकर जाएंगी. इन कनस्तरों में जो आपको नजर आ रहे हैं, गर वो सूरत में यहाँ पानी भरने आई हैं जिससे समाजी फासला रखना नामुमकिन है. इस पानी से अपने घर में खाना पकाएंगी, बच्चों के लिए, अपने माल मवेशियों के लिए कपड़े बर्तन धोने के लिए ये पानी इस्तेमाल होगा. लिहाजा इस कनस्तर से इतना कुछ करने के बाद बार बार हाथ धोने का तसव्वुर खारिज हो जाता है क्योंकि ये पानी इनकी जरूरत पूरी नहीं कर सकता. अब ये दूसरी तस्वीर देखें. ये भी थरपारकर के घर की है जो कि गोलाई में बने होते हैं. मेरे फोन के फ्रेम में इतने ही लोग आ रहे हैं जबकि इतने ही लोग दूसरी तरफ भी बैठे हैं. अब बात यह है कि अगर यहाँ पे किसी को कोविड होता है तो ये खुद को अलग कैसे करेंगे क्योंकि ये इनका पूरा घर है और ये एक घर में दर्जनों अफराद रहते हैं. और ये दूसरी तस्वीर एक बाजार की है जहां लोग, इनकी दुकानों के रकबे बहुत छोटा होता है. तो ये लोग कैसे समाजी फासला रख सकते हैं? कहने का मकसद ये है कि जब हम इसे हल बताते हैं जिनमें समाजी फासला या खुद को अलग रखने की बात होती है तो ये लोग इस पर अमल कैसे कर सकते हैं? ये इनके लिए नामुमकिन है. अब ये तीसरी तस्वीर देखें. हम बात कर रहे हैं सफाई की और हाथ धोने की. ये यहाँ के मकामी बैतुल खला हैं जो कि अवामी हैं. सब लोग यही बैतुल खला इस्तेमाल करते हैं. लिहाजा समाजी फासला और सफाई मुमकिन ही नहीं. और ये भी इन लोगों के लिए है जो निजी तौर पर बैतुल खला इस्तेमाल करना चाहते हैं, वरना बहुत से लोग खुले में चले जाते हैं. शायद हमारा मुल्क इस हवाले से दुनिया में नंबर 6 पर आता है. अगली तस्वीर पे आते हैं. ये है इनके घर जहां ये लोग रहते हैं. ये छोटी सी गोल चीज आपको नजर आ रही होगी. ये हमने एक ऑर्गेनाइजेशन के साथ मिलकर इन औरतों को फराहम किए थे ताकि ये आसानी से इसमें पानी भर कर ला सकें क्योंकि बहुत सी औरतें जो बूढ़ी होती हैं या हामला या फिर किसी भी और किस्म के मर्ज में मुब्तला होती हैं तो हम इनका जिस्मानी बोझ कम करने के लिए ये कोशिश की है. तो इस तरह की कम्युनिटी में कोविड के हवाले से बात करना नामुमकिन है क्योंकि हमें मालूम ही नहीं हो सकता कि कौन किस बीमारी से मर रहा है. अब अगली तस्वीर की जानिब चलते हैं. ये है कराची. ये कराची के इलाके पंजाब कॉलोनी का एक मंजर है जो कि कराची के एक पोश इलाके का पड़ोस है. जब पोश कहा जाता है तो मैं समझ नहीं पाती कि इससे लोगों का क्या मकसद है. तो ऐसे इलाके जहां इतने छोटे घर, इतनी तंग गलियां और इतने माले हैं, हम SOPs पर किस तरह अमल कर सकते हैं? इस तरह ये एक दूसरी आबादी की तस्वीर है. यहाँ पर भी कोई रिहायशी मंसूबा बंदी नजर नहीं आ रही. तो अगर यहाँ पर वबा की असरात होते हैं तो कैसे एहतियात हो पाएगी और वबा का फैलाव किस तरह मालूम होगा क्योंकि टेस्ट कौन करवा रहा है और कौन किस मर्ज में मर रहा है ये कैसे पता लगेगा? 60% आबादी कराची की ऐसी है जो इलाकों में रिहाइश पजीर है. तो आप यहाँ SOPs पर कैसे अमल दरामद करवा सकते हैं? हाँ, आप उन लोगों को घर में बंद जरूर कर सकते हैं जिनके महल्ले में रेंजर्स को तैनात करके सड़कें बंद कर सकते हैं, मगर इतने छोटे घर में अगर कोई एक भी इंसान वबा का शिकार है तो यकीनन पूरा घर ही वबा में मुब्तला हो जाएगा. अगली स्लाइड देखते हैं. जी, तो ये किसकी जिम्मेदारी है? इसको ऐसे लिखने की वजह सबसे पहले हुकूमत है. यकीनन हुकूमत की जिम्मेदारी है वसाइल की फराहमी को यकीनी बनाना. दूसरी है सिविल सोसाइटी, CSOs, यानी यकीनन पहले ही अपने कांधों पर जरूरत से जायद बोझ उठाए हुए है. عوام کو آگاہی پہنچانے میں CSOs اپنے کردار ادا کر سکتی ہے، لیکن جو کام حکومت کر سکتی ہے، جو کام حکومت کو کرنے چاہیے، وہ CSOs، NGOs، INGO نہیں کر سکتی۔ پھر بات آتی ہے انفرادی عمل کی۔ انفرادی طور پر ہمیں اپنے حصے کی ذمہ داری نبھانے کی ضرورت ہے۔ جیسے کہ ہم پانی ضائع کرتے ہیں، ہمیں نہیں کرنا چاہیے۔ یقیناً جو خاندان ایک ڈرم پانی کے ساتھ پورا دن گزار رہا ہے، وہ تو پانی ضائع نہیں کر رہا۔ جن لوگوں کو پانی وافر مقدار میں دستیاب ہے، انہیں چاہیے کہ پانی ضائع نہ کریں۔ اب SDG 6 میں حکومت، عوام، CSO، NGOs سب کی ذمہ داری ہے کہ اس پر نظر رکھے اور پانی کے نظام کو بہتر بنانے کی کوشش کرے، کیونکہ 2030 کی ہم بات کرتے ہیں تو وہ بہت قریب ہے۔ مجھے امید ہے کہ ہم اس پر کام کر سکیں گے۔